Hi everyone, Dr. Nagori here, back with FemHealth. Today I'm talking to Dr. Brooke Jeffy about Accutane. Dr. Jeffy is a board certified dermatologist. She practices in Arizona, and we're so grateful to have her here to answer all our questions about skin. So Dr. Jeffy, tell me about Accutane. What is it and how does it work?
Yeah, so Accutane is a brand name, first of all, of a drug called isotretinoin. And so there's a couple of other names for it, but Accutane is probably the most common one. So we'll use that. Accutane is high dose vitamin A. So sometimes that's helpful for patients who are interested in, trying to treat things a little bit more naturally. It is sort of a natural product. You can think of it as a natural product. But vitamin A, what it does is it affects all aspects of acne formation. So it really hits every target. So it stabilizes our skin turnover so we don't get clogging of the pores, which is kind of an early step that can contribute to acne. It has antimicrobial properties. So it is effective as a mild type of antibiotic against the normal bacteria on our skin, Cutibacterium, that can contribute to acne. It also has just generic anti-inflammatory properties, so can be helpful to calm acne in that manner. And then lastly, it also reduces sebum production by directly affecting how the oil glands produce sebum. So all the factors that contribute to acne, Accutane hits. It is a great medication for acne that is very severe or is not responding to other ways that we may treat.
So you had mentioned that it's vitamin A. Of course, my next question is, can I just take a lot of vitamin A? And if so, like, what does that mean? What kind of dose are you looking at? And what's the reason that people actually don't do that? Because we know people aren't doing that.
Yeah, well, there are actually some supplements now that are marketed as acne treatment supplements that contain higher doses of vitamin A. There are, of course, some loose guidelines about the amount of vitamin A one should ingest. But Accutane is different because it is high dose vitamin A. And high doses have a lot of potential side effects. So they do need to be, a patient on Accutane does need to be monitored for a variety of things that can happen. So again, there are some supplements kind of saying they're vitamin A, they're not anywhere near the high dose. Maybe they help in some manner, but they're not controlled. Mm-hmm. Okay. And just again, I encourage patients not to really do that because you're not getting the doses you need to affect acne. And if you were to just decide to take a huge amount of over-the-counter vitamin A, you're going to be at risk for some side effects, some of which are serious with Accutane. It's a very serious drug.
What are some of those side effects that patients can have?
Yeah, well, the most terrifying side effect is that women who are taking the drug, if they become pregnant while they're on it, it causes birth defects. Mm-hmm. So there are systems in place that monitor how dermatologists prescribe the drug so that we can be sure our patients are staying safe in terms of that pregnancy risk. But the side effects, it can affect your liver, it can affect cholesterol triglyceride levels. You can rarely, but you can sometimes see pancreatitis happen with it. There's a whole host of other side effects, mood changes, hair loss. You definitely get dry skin, dry eyes, sometimes nosebleeds. So it's a lot.
Yeah. Yeah.
But used carefully, it's a great drug as long as you're monitoring it and being careful with it, and it changes lives.
Can you use it at any point in life, or is it usually?
Yes, you can. You can. I do have, so we do it usually a little differently in adults. Sometimes you can do actually a very low dose, but over a long term versus if we are treating teens. A lot of times we try to do a dose based on weight. We try to get it in as fast as we can over 6 months. They experience a lot more side effects, but we can usually kind of coach them through it versus adults don't want to have peeling skin and cracked lips. So a lower dose over a long term, we will sometimes modify treatment that way.
This is really helpful to know because obviously we don't want people to sort of self-medicate and go out there and take high doses of vitamin A, which can cause a host of other issues. Have you seen pseudotumor cerebri from vitamin A ingestion or Accutane?
Yeah, good point. I forgot to point out that one. I have not personally. We usually see it in patients who are, what we watch for carefully is patients who are on other drugs that make that more likely. So you would certainly never want someone who is on Accutane to also be on something like doxycycline, for example. That really compounds the likelihood that issue happening. But yes, that is something we monitor patients for by asking them if they have to let us know if they have headaches or if they have vision changes. But no, in my practice over the past 12 years, I've not actually seen anyone have that. Have you seen that in conjunction with Accutane that you know of?
Not that I know of,
Yeah.
but I have seen it with birth control. And so that's another, I know, commonly used drug to control acne. So I was wondering also about maybe birth control and Accutane, if there's a higher risk. I'm assuming there is.
Yeah, I believe that there is, but we pretty much always, unless there is some reason that a patient cannot go on a birth control pill, most dermatologists require that if they're going to be on Accutane because of that pregnancy risk. So again, I would say, near 100% of my female patients who can get pregnant are on a birth control pill. And again, not really seen that. So must still be incredibly low.
This was super helpful. Really great information about Accutane. Thanks for being here, and we'll see you next time.
Thank you.